Well, Mr. McGurnan, my name is Becca, and I'll be performing your physical exam today. Can you tell me what brings you to the clinic?
A checkup.
Okay. I will start off by washing my hands. Now I have a few questions for you just to assess your level of consciousness. Can you tell me your name, please?
Chris McGronin.
And what month is it?
September.
Where are you right now?
At my house.
Okay, and who is our president?
Donald Trump.
Okay, are you having any pain at this time?
Negative.
Okay. I will now inspect your face and your head. I'll start by looking at your skin. Skin appears normal, pink, no discolorations, and symmetrical. Head appears symmetrical. I will palpate it. Let me know if you feel any tenderness. Hair is evenly distributed with good texture. Any tenderness on palpation?
No.
Okay. I'm gonna assess your facial nerve, which is cranial nerve number 7. Could you please smile for me and frown and puff out your cheeks, please? Okay, thank you. At this time, I'm going to look at your eyes. Your eyebrows and eyelashes have good hair distribution. Lids, can you open and close your eyes, please? Lids open and close without any difficulty. No ptosis, fasciculation, or tremors noted in the eyelids. I'm going to pull down your bottom lid here. Conjunctiva pink without any abnormal drainage. Sclera appears white and avascular. Cornea is clear. I'm now going to shine a light in your eyes just to assess your pupils. Pupils are even, round, reactive to light. Could you follow my pen light, please?
Mm-hmm.
Good accommodation. At this time, I'm going to assess your ears. Ears appear symmetrical bilaterally. The outer right auricle appears normal without any redness or edema. Ear canal appears clear with no drainage. Is there any tenderness?
Negative.
Tympanic membrane is visualized. It is a grayish pearl color without any bulging. Light reflex is located at 5 o'clock. Left outer auricle appears normal without any redness or drainage or edema. Any tenderness?
Negative.
Ear canal without drainage or foreign bodies noted. Left tympanic membrane is a pearlish gray. Light reflex located at 7 o'clock. No bulging or perforations noted. I'm now going to assess your nose. Nose appears midline of the face and symmetrical. Nares are symmetrical and even. Septum is midline. No drainage noted. At this time, we'll be looking at your mouth. Lips appear pink in color without any, and moist without any dryness or cracking. Buccal mucosa is moist without any lesions noted. Good dentition with no caries noted. Can you stick your tongue out, please? Hypoglossal nerve, cranial nerve number 12 intact. All right, you can pull it back in. Tongue is midline. Hard and soft palate intact. All right, I'm going to look at your posterior oral pharynx. Posterior oral pharynx without redness or edema. Say ah.
Ah.
Tonsils present without edema, redness, or drainage. uvula midline, and rises on assessment of cranial nerve number 9 and 10. Okay. At this time, I'm going to assess your neck. On the inspection of the skin of the neck, there are no skin abnormalities noted, no lesions or lumps, no jugular vein distension noted, no irregular pulsations. I'm going to palpate your carotid arteries at this time. Bilateral carotid arteries palpated at a +2, swallow. Trachea midline. At this time, could you please take your shirt off? I'm going to do an assessment of your chest. Okay. The skin of the thorax appears normal without any lesions or abrasions noted. Shape of the thorax appears normal without any signs of virile chest. Patient's respirations are even and unlabored. I will now listen to the breath sounds. Can you take a deep breath for me? At this time, we'll assess the heart. I'll start by palpating the apical pulse. Apical pulse is located at the 5th intercostal space on the left side midclavicular line. Now listen to the apical pulse. Apical pulse at a rate of 80 and normal. At this time, I'm going to listen to the other heart sounds. We will start with the aortic valve, which is located at the 2nd intercostal space, right sternal border. Then the pulmonic valve, which is located at the 2nd intercostal space, left sternal border. Erb's point, which is located at the 3rd intercostal space, left sternal border. The tricuspid valve, which is located at the 4th intercostal space, left sternal border, and then we'll end with the mitral valve, which is located, also known as apical pulse, which is located at the 5th intercostal space, left midclavicular line. I will start by auscultating with the bell of my stethoscope, and then I will also go back and listen with the, no, I'll start with the diaphragm of my stethoscope, and then I will go back and listen with the bell of my stethoscope. heart sounds with the normal limits, S1 and S2, heard on auscultation, no murmurs noted. All right, at this time, if you would lay down, I'm going to assess your abdomen. Abdomen appears symmetrical. Skin is pink. On the thorax and the abdomen, I would feel the temperature. Temperature is warm with good skin turgor. The abdomen appears non-distended, no pulsations or peristalsis noted on inspection. At this time, I will auscultate or listen to your bowel sounds. Bowel sounds are normal active. I'm now going to palpate or press on your stomach. I will start with light palpation. If you would just let me know if there's any tenderness. Any tenderness? All right, I'm now going to palpate a little bit deeper. Any tenderness? Abdomen soft, non-tender, times 4 quadrants, no masses noted upon palpation. I'm now going to inspect the upper extremities. You can put your shirt back on if you would like. All right. Upper extremities appear symmetrical. No abnormalities of the skin. There are small nevi noted that are symmetrical without any discolorations. Let me know if there's any tenderness in your joints on range of motion.
Nope.
No tenderness on range of motion. No edema noted. On the right side, same with this side. Any tenderness?
Negative.
No tenderness noted on range of motion. No edema in the joints noted. Skin is warm to touch. Skin is warm to touch. Radial pulses palpable bilaterally at +2. Cap refill less than 3 seconds in bilateral fingers. And if you'll lay back, the last thing we're going to assess are your lower extremities. I'm just going to assess your hips and your knee joints. And your knee up here. Any tenderness?
No.
Any tenderness in your knee? No tenderness or edema noted. In the right knee. Any tenderness?
Mm-mm.
No tenderness or edema noted in the left knee. Skin appears normal, pink, good hair distribution on bilateral legs. Skin is warm to touch. There's no pre-tibial edema. Dorsalis pedis, pulses palpable bilaterally at +2. Posterior tibial pulses palpable bilaterally at +2. And cap refill less than 3 in bilateral toes. Thank you, Mr. McGronin. Your physical assessment is complete at this time.
Thank you.